Hello and welcome to the AWS Public Sector Summit Online. We're thrilled to have you. On a personal note, I want to say thank you for adjusting with us in these unprecedented times. The world is still in the middle of responding to a global pandemic. This has been both a personal and a professional challenge for everyone. But through this challenge, there have been opportunities to learn, both about our organizations, our people, and our IT infrastructure. And so over the next 40 minutes, through the lens of our customers and our partners' experience, I want to share with you the lessons that we've learned at AWS and how you can apply these lessons to your own journey to the cloud. We've seen 4 key principles emerge from our customers' experience that can help you transform your tech stack, deliver modern services, and ultimately improve the way that you serve your mission, your customers, your constituents, and your students. They are move fast, have an agile platform, keep innovating, and think big. So let's jump right in. The first principle I want to discuss is speed. Moving fast is a prerequisite to transforming your organization. COVID-19 made clear how those who move fast can be prepared to respond to unexpected shocks. Organizations already using the AWS cloud had a big advantage because they could quickly double down on transformation projects. Take an organization like ALIF Education. This edtech based in the Middle East was already working in the cloud. When the pandemic hit, ALIF was able to quickly scale and provide free access to their learning solution to tens of thousands of students who were stuck at home. Other organizations quickly realized the need to move to the cloud to successfully respond to the pandemic. Take Comune di Codogno in Italy. Using Connect, the municipality built a call center in less than a week to route calls directly to staff at home, responding to citizens' questions on COVID-19. That's fast. One of the powerful ways to increase your own pace of innovation is to tap into AWS partners. Around the world, these partners have the experience and the expertise to overcome blockers and implement solutions that help you serve your mission. Our partner, CDSM Thinky, comes to mind. They partnered with the Egypt Ministry of Education to quickly connect students to an e-learning platform, which received more than 7.3 million page views in its first 5 hours after launch. That's scale. And since schools closed in March, it's hosted millions of users each month. These stories are inspiring, and I can't wait for you to hear directly from someone who is driving rapid transformation within the public sector. Nonprofits often leverage cloud computing to quickly reduce the burden of IT and to spend those resources on their mission instead. Our first speaker is no different. Miss Eve Curry is the Executive Director of Planning and Strategy for a nonprofit aged care provider in Western Australia called Juniper. When COVID hit, she knew her organization had to act quickly to protect caregivers and community members alike. By leveraging the power of the cloud, Juniper was able to quickly respond to COVID and keep community members safe. And here to tell us more is Miss Eve Curry.
Thank you, Max. Juniper is a not-for-profit aged care provider that manages quality retirement living, residential aged care, and in-home care services across Western Australia. Our organisation has been around since 1949, and we've grown to become a leading provider of these services with 26 residential care facilities, 14 retirement villages, and 4 home and community centres across 2.6 million square kilometres, supporting approximately 5,000 elderly citizens. I'm really passionate about our mission to enhance the independence, spiritual fulfilment, and enjoyment of life for elderly people, which we're achieving through care, accommodation, and a broad range of specialised support services. Providing quality aged care and maintaining community interaction for our residents and clients is the key focus for all our efforts, including facilitating family visits, ensuring regular contact with care providers, and coordinating fun social events like having students come in and sing or local artists share their work. When COVID-19 hit, there was a big physical divide to protect our community's most vulnerable population through social distancing requirements that created an unfortunate separation between individuals and significantly shifted our approach to work. We knew we had to respond quickly to maintain quality care, to ensure that our caregivers didn't experience any disruptions in providing support, that our residents were able to connect simply and safely with employees and family members, and that concerned loved ones could easily get updates and information. And we needed to make sure all of Juniper's employees were able to seamlessly transition from our more traditional model to working remotely with secure access to all files and data needed. In under a week, we worked with the AWS professional services team to roll out Amazon Chime, a video conferencing tool that has allowed all stakeholders to stay connected, including external users like family members, which has been vital to the well-being of our residents. We adopted Amazon Workspaces that lets employees work from home more effectively, even in remote locations, to maintain business continuity. And we set up Amazon Connect, an automated contact centre, so that we are prepared to respond to a surge in demand from employees and families looking for information in the event of a COVID-19 outbreak or any other emergency. Within just a matter of days, we leveraged these AWS solutions to connect more than 3,000 employees, caregivers, doctors, allied health professionals, and family members virtually to keep them safe and ensure operations could continue to run smoothly during this critical time. We were able to do this all so quickly and effectively because of the digital transformation strategy that we initiated a couple of years ago. Our cloud journey began with AWS back in February 2019 as we saw the need to modernise our historically traditional technology approach. There were challenges with our on-premise infrastructure, and we were experiencing low connectivity in the remote locations of our facilities, which prevented the use of other software and devices and restricted our overall mobility. AWS has helped to enhance and transform our workforce to be able to easily build out new systems and scale more cost effectively. We've also been able to significantly improve our data tracking and analytical reporting capabilities. And we've since experienced a few organisational milestones. We recently held our first ever company-wide leadership team CEO address with Amazon Chime, as we previously had to use separate systems that made it difficult to manage, scale, and access. Increased connectivity with the cloud has allowed us to roll out new technologies that can be used on the front line at the point of care and enable instant patient reporting. This has greatly improved efficiencies. Caregivers and nurses can now use clinical applications to update health records of residents and clients and view their preferences immediately, allowing them to spend more time interacting and connecting with our residents and clients. And from a logistical perspective, we were able to implement influenza vaccination tracking as recently mandated by the government, which wouldn't have been possible on our previous system. While some of our employees were initially concerned about having to learn new systems and change their ways of working, they've seen the ease and benefits from being able to quickly connect and share documents and screens from anywhere. We've even started using Amazon Chime as a training tool instead of having our trainers travel to office sites across the country. It's truly changing the way we work and expanding what is possible within our organisation. Beyond supporting our workforce, increased connectivity with the cloud has also allowed residents to maintain active social lives and avoid feelings of isolation, particularly with the arrival of COVID-19 and the need for restricted visiting arrangements at our facilities. They're now able to use new devices to easily connect with family members and friends through Amazon Chime, and it's been so rewarding and heartwarming to see their faces light up during these virtual interactions. This is, without a doubt, the new age for quality aged care, and we're excited to continue to revolutionise the way in which it is provided to further enhance and positively impact the lives of our residents and clients. Thank you.
Thank you, Eve. It's clear that you've made a difference for thousands of residents and their families. What a great example of moving fast and adapting in near real time to meet your mission. So, we talked about the first principle for digital transformation, speed. The second ingredient for success is to deliver citizen services in an agile and flexible way. I miss seeing our customers in person. We all like to spend high-quality time in face-to-face interactions. But COVID-19 has also made clear that there are incredible opportunities to more efficiently provide a lot of services by using digital technology. Telemedicine is just one example where digital technology is having a major impact. Singapore-based Dr. Anywhere swiftly expanded telemedicine services to other countries in the region, thanks to the ability to scale quickly and securely on AWS. Now, part of becoming a flexible organization also means spending every IT dollar effectively. And when budgets face increased pressure, you can't afford to double your costs just to double your capacity. Cloud allows you to scale in a cost-effective way. For example, nonprofit Hello Sunday Morning found that demand for their sobriety app soared amid the pandemic lockdowns and alcohol consumption. Their app, Daybreak, which provides help for those critical social health services, was able to scale up immediately without impacting their budget. Look, the simple fact is that COVID-19 won't be the last test for public sector customers. You can't always predict the future. Instead, you all have to be prepared. And that's why every public sector organization needs to have the flexibility and the agility to respond to the next crisis before it arrives. Start transforming now, and you'll never know when you'll unexpectedly benefit from that progress you've made. Our next speaker is a great example of how the cloud allows an organization to flex in the face of unexpected events. The Selangor state government of Malaysia had already started their flexible, agile IT journey to the cloud when the pandemic hit. The work that they completed allowed the state to quickly pivot and deliver new and important services specifically tailored to address the COVID crisis. So please join me now in welcoming Dr. Muhammad Fahmi Enga, Managing Director of the Smart Selangor Delivery Unit, who's going to tell us more.
Thank you, Max. Smart Selangor Delivery Unit is a Selangor State Government-owned company which has been mandated by the Selangor State Government of Malaysia to spearhead and implement smart initiatives throughout Selangor. These efforts are helping to achieve its vision of becoming a livable, regional smart state in ASEAN by 2025, with the aspiration to be economically vibrant, environmentally sustainable, and in close engagement with its citizens. Our framework focuses on 4 smart domains that infuse technology and smart solutions. And citizen centricity is at the heart of making our smart state a reality. With a population of 6.5 million people, it is critical that our solutions are highly available, reliable, and scalable at the same time. The cloud has been essential in ensuring that our services can be easily accessed by anyone within the state. We began working with AWS in 2018 by building a citizens' electronic payments platform that enables citizens to easily access paid government services through a central mobile and web portal, which presented a need for rapid scalability. Working across the state government, local councils, and district offices, we had initially experienced some challenges because the cloud was new and there were conflicting interests on innovation across the different entities. For instance, we didn't have the depth of knowledge around digital security and privacy, and some apps were being built without proper security being thought of from the start. In working with AWS, we were able to adopt security policies proven to be effective across other governments and private sector organizations and create a central framework that could be used by everyone. This was key to help enable intra-government agency and government private sector collaborations. We are currently developing a hybrid cloud data center for the state government that provides high availability to support our applications. This allows us to build more apps more efficiently as we're able to pre-develop solutions which are then easily productized and scaled. We have also been able to conduct big data analyses using near real-time data from across the entire state through the central platform, which has helped to identify trends and sensitivities that allow us to forecast and further optimize our services. The scalable infrastructure has also allowed us to quickly roll out new solutions and pilots without a big upfront investment, particularly in response to COVID-19. At the beginning of the pandemic, we rolled out an operations dashboard that provided the state with critical data so it could make real-time decisions and enforce containment measures quickly. This has helped to minimize the number of transmission cases and, more importantly, reduce fear of the public. We also work with over 1,000 local traders to shift from their physical markets to selling their products online, allowing them to maintain business continuity at a time when in-person gatherings weren't allowed. As we continue to look ahead, we are prioritizing skills development to support an innovative workforce, particularly within government, helping citizens better prepare for careers of the future. We have embedded our Smart Selangor Accelerator program with AWS Academy and AWS Cloud Start to develop the skills necessary to adopt cloud technologies. Universities across the state are also adopting cloud computing curricula from the AWS Educate initiative to help develop the next generation of cloud professionals with a target of 200,000 students and professionals trained by the year 2025. To better support local businesses, we recently launched a cloud adoption program called the Smart Selangor Cloud Accelerator for Enterprises, or SCALE, which is powered by AWS to provide reliable, easy-to-use, and cost-effective solutions to help them scale and grow. All of these efforts are helping us to track our established targets towards becoming a smart state, and it is still just the beginning. We are currently 40% through our program with a total of 60 initiatives that needs to be carried out by 2025. This effort also involves upgrading necessary digital infrastructures across at least 50 entities within the state. The cloud has not only been essential in accelerating our digital transformation to deliver accessible and equitable citizen-centric services, it has also driven us to rethink what digitalization really means and what other new possibilities could be. It is helping us to shift our operations culture, both in government and businesses, retrain our workforce, and acquire new skills, enabling us to build the necessary foundational skills today so that we can innovate even further and faster in the future. Thank you.
Thank you, Dr. Fahmy. The story you just shared about investing in a modern, well-architected, and secure cloud-based system demonstrates just how you can be more agile in the cloud while also enhancing security. So we just finished talking about the need for speed and a flexible IT infrastructure. The next principle I want to discuss with you is the need to think about your IT's impact on mission. The truth is, IT should not be separate from your mission. When you eliminate the limitations of legacy IT infrastructure, technology can enable your mission. And this flexibility and freedom means that you can continuously experiment to deliver new services in new ways. Our platform enables continuous innovation by our customers and our partners, but it's not just technology. As an organization, AWS is committed to supporting you as you experiment and build. When the crisis started, for example, we moved fast to support medical researchers on the front line. We launched the Diagnostic Development Initiative in March and committed $20 million in credits and technical support for research into diagnostic solutions. Today, the Diagnostic Development Initiative is supporting dozens of projects, including a project to address the COVID-19 testing gap by modeling virus mutations and inferring the likely number of undetected transmissions. Researchers are also analyzing chest x-rays with AWS machine learning to detect pneumonia caused by COVID. And this means faster results compared to other COVID-19 tests on the market today. Beyond medical research, we continue to offer programs and opportunities for public sector customers to experiment on AWS. And once again this year, we're supporting local governments and school districts and not-for-profits through our City on the Cloud competition. And now the City on the Cloud competition is open to more global governments around the world to participate. This program is a chance for you to tell us how you are making a positive impact for your citizens, solving a problem, or enhancing your city. And winning applications receive AWS support, including credits and financial support, to bring your project from idea to reality. I encourage you to learn more at the URL you see here and submit your own project by December 15th. Another critical component of continuous innovation is developing a workforce ready and excited to build on the cloud. AWS and our customers are tackling this issue head on. In Egypt, AWS has worked with the Ministry of Communications and Information Technology to design a workforce development and a skill building program with machine learning and AI capabilities. Please welcome the Deputy Minister for Administrative Development, Digital Transformation and Automation, Khalid Al-Attar, who will tell us more about this innovative program.
Hello, everybody. We are here from Egypt, the land of history, culture, and civilization. I am from Ministry of Communication and Information Technology to give you a view about the digital transformation of Egypt. Basically, our digital transformation is based on the mission of Ministry of Communication and Information Technology to enable the society to use ICT in every aspect of life to address societal challenges and to capture social opportunities. Basically, our digital transformation strategy is data-driven, so that's why we started with the data platform as the first platform to build, where it drives the quality of service, the personalization of service, and also the policy innovation and service innovation in order to make the country better for its citizens, its business, and also its social sector. The other platforms are related to services, related to payment and economic inclusion, related to the geospace and the geolocation in Egypt, related to the government employee to streamline her or his activities, and in order to make him able to collaborate and to flow the information freely among the different government servants in order to provide better service and better practice for the Egyptian citizen. We have also the last part, which is related to the treasure that Egypt and the Egyptians have produced over the 1,000 years, from the Pharaoh's time till the modern time, where we have plenty of publications from newspapers, magazines, books, articles, and others. We are putting this into a content platform, and we are enabling this with a search engine that is based on artificial intelligence and machine learning in order to actually allow the citizen and allow the researchers to go through the information and skim through hundreds of years of knowledge that the Egyptians have produced. At the same time, I would like also to tell you about the main essence of the digital transformation. It's all about collaboration. It's all about being connected and being integrated. So basically, the digital transformation also includes the connectivity among all the government agencies, right, over 30 plus ministries and 40 plus associations, all connected, all flowing information and data among themselves, so the citizen can get the better service. The second point I would like to talk about, which is another essence of the digital transformation, is the engagement and level of engagement we have from the citizens. Digital.gov.eg is not a simple portal where we provide services. It is a platform that connects businesses, that connects service providers, that connects the government agencies in all possible fronts, and all to serve the citizen. So the main essence of the digital transformation is citizen centricity. So the last thing I would like to tell you, that we have an accumulation of data, an accumulation of information, and the necessity for going out of any servers that exist in one state. So we needed to move to cloud. And with cloud, there is an opportunity, but there is also the challenges of privacy and security. So we are working with Amazon as our partners and other partners to build the capacity to protect our citizens and to protect our society. We did not stop at that because the most important element is the Egyptian citizen and the Egyptian professional. So we launched a number of programs for the training at all levels, inclusively into the entire country. And we are happy to partner with Amazon into this training for the first 500 into AI and machine learning, among other training programs that will span over 100,000 of Egyptian professionals to work and participate and collaborate into the digital transformation. Many thanks for the time and many thanks for the opportunity.
Thank you, Deputy Minister El-Attar, for sharing this important investment in the workforce needed to realize the full potential of the cloud. I'm excited to see how this will drive further innovation in Egypt. Let us know how we can keep helping you. The fourth thing that we've learned from our customers and our partners is that when you move beyond legacy service delivery and you become an organization of continuous innovation, you start realizing that anything is possible. You can begin accomplishing some incredible things. Take the challenge faced by many governments: how to more quickly communicate with citizens during the COVID crisis. Our customers had to quickly find new ways to communicate with their constituents, even at 10 times the volume they were prepared for. This meant exploring modern call centers on the cloud and employing modern tools like chatbots and automated voice response systems. For example, our partner Sparktronics worked with 14 state governments in the U.S. to modernize unemployment insurance benefits. In the state of West Virginia, a cloud-based contact center went live in less than 3 days. Remember speed? Automation tools like Amazon Polly, a text-to-speech service, helped to manage initial call flow by providing callers with basic information. And now 96% of the calls are handled by an interactive voice response system, enabling the state to meet this unprecedented demand. West Virginia also plans to add Amazon Lex, an AI-enabled chatbot, to its website to further expand capacity. And healthcare is another sector that has undergone incredible transformation. Here again, customers have teamed up with AWS partners to adjust course in the face of unexpected demand. In Latin America, for example, AWS partner Yline is using artificial intelligence to reduce overcrowding and congestion in hospitals by allowing patients to view wait times and join the queue remotely. And while telemedicine was a growing field before COVID, that trend has simply accelerated. In Singapore, nonprofit We Care Community Services had to shift counseling sessions from video calls to enable providers to work more remotely when COVID hit. They were able to adapt quickly using AWS, and they actually doubled the volume of therapy sessions that they were able to provide to patients. Another powerful example comes from India, where Dr. Sanjay Sood and the Center for Development of Advanced Computing are transforming healthcare delivery. As the Associate Director for Health Informatics, Dr. Sood collaborated with AWS to launch a digital consultation system in just 19 days. His journey is an inspiring example of how all three principles we've discussed, moving fast, being agile, and committing to continuous innovation, delivers mission-driven results.
Thanks, Max. The Center for Development of Advanced Computing, or CDAC, is the premier research and development organization of the Ministry of Electronics and Information Technology and executive agency of the Government of India. We're focused on strengthening national technology capabilities and applications by designing, developing, and deploying world-class electronic and IT solutions that are centered around various themes, including telemedicine and e-health. We've been building out telemedicine capabilities since 2000 amongst the pioneers here in Southeast Asia. We began with the development of eSanjeevani, an indigenous telemedicine system to enable doctor-to-doctor teleconsultations that allows providers to seek health services from other medical specialists. For the Ministry of Health and Family Welfare, eSanjeevani is being implemented at over 155,000 health and wellness centers in the country under Ayushman Bharat scheme, the world's largest health insurance scheme. As COVID-19 hit, there was a critical need for patient-to-doctor telemedicine solutions as the country went into lockdown and outpatient departments or OPDs closed down. The Government of India released new guidelines for telemedicine and simultaneously directed Health Informatics Group at CDAC's center in Mohali to develop an online OPD to serve as the central platform for the entire country's healthcare delivery system, which is usually governed at the provincial or state level. Paid private telemedicine solutions were already established, but only available to those who could afford them. So the country needed to provide a system that was accessible, easy to use, and free for all citizens at the time they needed it most. The biggest challenge we faced was determining the hosting infrastructure that could support a system of this magnitude. The Ministry of Health and Family Welfare and Ministry of Electronics and Information Technology connected us with AWS, which was an impactful moment. AWS had all the necessary capabilities and solutions for scalability and security, and their team was ready to help us move quickly. Our team didn't initially have the skill sets needed because cloud computing was new for us. But AWS helped guide and train our staff throughout this entire process, ensuring our team understood the AWS console and was equipped to manage day-to-day operations. We started development with lift and shift of ASP.NET application with MySQL backend to cloud and setting up the application on Linux EC2 instance using .NET Core framework, and then conducted performance testing to fine-tune the optimize the application. We developed the queue engine using SQS, AWS Lambda, and DynamoDB, which handles the crucial waiting queue for patients, and then refined the architecture by implementing application load balancer, Elastic Cache, and RDS MySQL to eliminate manual setup and management of these components. In working with AWS, we were able to launch the eSanjeevani OPD teleconsultation system in just 19 days and rolled it out in 4 states. This free telemedicine service includes video audio consultations with a doctor, generation of e-prescriptions, and chat capabilities, and is available for 12 hours a day, 7 days a week. This is enabling more than 1 billion people across all population segments to seek support virtually from the confines of their homes, supporting life-saving interventions, which otherwise wouldn't have been possible. We're reaching out to around 80% of India's population and currently averaging 6,000 consultations a day across 23 states with around 4,000 doctors who've been trained and onboarded, hosting 150 OPDs, 30 that are general, and over 100 that are specialized. And the demand for the system is growing in states that have not yet rolled it out. The Ministry of Health and Family Welfare has set a goal to support at least 100,000 consultations per day, shaping eSanjeevani OPD into the world's largest telemedicine system. With increased accessibility across the masses and growing adoption, the positive impact telemedicine is having on the country is already clear. This all wouldn't have been possible without AWS by our side, and we now have full confidence in the ability to support ongoing platform growth and increased downloads day in and day out. And we are looking forward to the advancements and innovation yet to come, ensuring all citizens across India are able to receive quality medical care whenever and wherever they need it. Thank you.
Thank you, Dr. Sood. It's incredible to learn about the speed and the scale of your service. We can't wait to see what's next. I hope today's keynote has helped you envision how an IT model built on the cloud is mission critical. As I close, I want to give you 3 action items for today that'll help you get the most out of this summit and to accelerate your own journey to the cloud. First, check out local updates from your AWS country leaders. These short videos will give you a local look at trends, services, programs, and announcements. Second, explore our technical tracks in their entirety. No matter your level of experience, there are sessions tailored for you. Third, I encourage you to spend extra time with our newest track of sessions called The New Workforce. It speaks to our new culture of remote work and learning as we build toward a new normal. So thank you again for joining us today. I'm excited for your transformation journey to continue.